science behind beauty. And to give away the lecture, I would like to call Dr. Nisansala Nagodavithana. She's the consultant dermatologist at Base Hospital, Pimbura. Over to you, Nisansala.
Human preoccupation with beauty and a youthful appearance dates back as far as recorded history. And anthropologists have determined that over 40,000 years ago, red ochre paints were used in southern Africa for facial and body ornamentation. So in the current era, there is an exponential growth in cosmetic industry with mega marketing, which has inundated consumers with multitude of beauty products and procedures, many of which target females. Patients often consult us with cosmetic or procedure related problems, and more often than not, having done their research with Google at their fingertips. As dermatologists, being updated about current cosmetic trends will help to better manage our patients and their expectations. So, this is the scope that I would be covering. There is an overwhelming number of current cosmetic products and procedures for skin, nail, and hair care, and the list keeps growing. I will be overviewing some common skincare products and salon-based procedures with their scientific basis, potential adverse effects, and medical uses. Facial care is a cornerstone in improving one's appearance. So the cleanups are the commonest salon-based as well as at-home procedure that is aimed at deep cleaning the skin. This includes cleansing, exfoliating, extraction of comedones, and applying certain products. In contrast to cleanups, facials include massage, application of a face mask, and a pack in addition to a deep clean. Different types of facials exist and the list keeps growing. So this is a galvanic facial which uses a direct constant low voltage current passing through skin via electrodes as we use in iontophoresis. Hydrofacial is the trademark of a new expensive procedure which claims to combine 4 distinctive rejuvenation procedures in a single treatment. Despite the exorbitant price tag, it basically is a dermabrasion and a very light chemical peel. In contrast to other forms of dermabrasion, the machine shoots jets of water at the skin and vacuums it back off into a reservoir through a specialized tips known as hydrodermabrasion. Although looks exotic, these are gold facials. Gold has been used since ancient times to reduce inflammation. However, gold facials are a recent invention claiming to have certain skin benefits that has not been scientifically substantiated. It may show some effect due to other active ingredients and gold nanoparticles giving skin a temporary shimmery glow. Moving on to ultrasonic facial treatment. In contrast to regular ultrasonic devices, high-intensity focused ultrasound is an effective method to heat up deep layers in the skin such as the superficial muscular aponeurotic system, deep dermis and the papillodermis in order to provide tissue remodeling. Wool therapy is the trademark of one such device using high-frequency focused ultrasound and has been approved by FDA for non-invasive brow lift, neck, chin and décolletage lift. In photofacials, light sources such as intense pulse light and light-emitting diodes and photodynamic therapy can be used for facial rejuvenation, treatment of acne and pigmentary abnormalities. However, in our skin types, we may have the risk of hyperpigmentation. There are some good quality scientific data to support these claims too. Well, this is a vampire facial which received a huge publicity owing to celebrities and social media. PRP is applied topically following microneedling or fractional laser, which creates small channels up to the dermis. PRP can also be injected into the dermis. There are scientifically proven data regarding the effectiveness in scarring and facial rejuvenation for PRP together with or without microneedling or skin resurfacing. Well, there are enough and more complications with facials too. Facials can cause complications such as irritant and allergic contact dermatitis, and also it can cause burns due to incorrect use, especially in galvanic and IPL. And also it can cause certain peels such as certain facials such as jet peels can cause facial and periorbital cellulitis, and fat atrophy and nerve damage has been reported after high frequency focused ultrasound. So if the patient asks us, is it okay to have a facial? An occasion, what the American Academy of Dermatology Association says is that an occasional facial is okay if the patient enjoys it. However, routine skin care, including sun protection, is vital for the skin health. Now, a bit about sensitive skin. Some patients claim they have sensitive skin and unable to use any products. Well, it is an exaggerated reaction to any topical application, possibly due to reduced thickness of the stratum corneum, leading to increased penetration of the water-soluble chemicals. In addition, imbalance of intercellular lipids and neurogenic inflammation can also play a part. Let's move on to colored cosmetics. Colored cosmetics are an essential component in fashion, camouflaging, skin health, and sun protection. They are mainly foundations, powders, lipsticks, and mascaras. So, although this looks quite complex, let me quickly brief you on how a standard full face makeup is layered so that you know which products are commonly used. The number of steps can either increase or decrease depending on your preference, time, and the coverage needed. Now, ideally, after cleaning face, moisturizer and sunblock is applied, and a product called primer is meant to give a smoothened skin. And then foundation and concealer provide coverage and contour the face. Face powder seals off the foundation, while the blush gives a rosy cheeks. And then the eye makeup and the lip makeup follows. Foundations are basically pigmented moisturizers worn for 8 hours or longer before removal. Consequently, this class of colored facial cosmetics have the greatest impact on the integrity of the skin. Facial foundations are available for every complexion type and the skin color. Different types of foundations exist depending on the skin type and spreadability, such as liquid, cream, stick, loose powder, and mind you, the pancakes and mousse are not edible. They are formulated in oil or water base. Anhydrous forms are used when extreme coverage is needed, as in cosmetic camouflaging and theatrical makeup. Facial foundation is an excellent cosmetically elegant facial photoprotectant. Iron oxide, titanium oxide, zinc oxide, and kaolin in foundations act as physical sunscreen, while other organic sunscreens could also be added to increase the sun protection factor. For example, regular foundations without added organic sunscreen will provide an SPF of at least 4 compared to those with high coverage, such as anhydrous forms having a SPF about 8. This value could be increased by addition of organic sunscreen agents to provide adequate photoprotection. We do see some adverse effects of foundations, commonest being the perifollicular acneiform papules occurring after about 48 hours after using a foundation. They are not true acne and in fact considered as an irritant contact dermatitis. Moving on to powders. Facial powders are layered next on face to seal off foundation and to enhance oil absorption. They can provide additional coverage, smoothen the texture, and provide sun protection. They have different ingredients in order to serve different functions. Moving to facial blushes, these are powders that are applied to cheekbones to give color. And eyeshadows too are powders, but they have a wide variation in colors to suit fashion trends. However, the ingredients of eyeshadows have been regulated more stringently due to potential ophthalmic complications. Moving on to lipstick, they are essentially pigments and dyes that give color mixed with waxes and oils amongst other ingredients. There are functional lipsticks that can exert a plumping effect, and also that's important in sun protection, especially to prevent actinic cheilitis. Having said the benefits, there are adverse effects of lipsticks. Apart from the common cutaneous side effects that we see, there is a potential for heavy metal toxicity. Lead can be present as an impurity and is never mentioned under the ingredients, nor it is measured. It has been realized very recently that even very low levels of lead exposure is hazardous, particularly for in utero babies and in utero neonates. In utero babies and neonates. Sorry. This study found that this study in India, they have checked 48 commonly available lipsticks with very high fashion brands to the common locally made one, and found that the level of lead ranged from 2 to 8 micrograms per gram, that means 20 to 80 times higher than the FDA guidelines value of 0.1 micrograms. A little about mascara. These are designed to color, camouflage, curl and elongate and thicken the eyelashes. So the formulations are important, as recurrent dipping of the wand after using in water-based mascaras may lead to bacterial growth and associated ocular complications. Pseudomonas aeruginosa, Staph epidermidis, Staph aureus, fungal organisms are the commonest reported microbes. In addition, mascara can cause conjunctival irritation and also pigmentation from washing of mascara into the conjunctival sac by the lacrimal fluid. Let's talk about the medical use of colored cosmetics. The color cosmetics can be used to camouflage pigmentary defects. Now, facial, we see red color in face due to rosacea, psoriasis, and lupus. We could use green foundation to mask the redness by using it as a foundation. So, the yellow color that is perceived in solar elastosis, chemotherapy, or dialysis can be covered with purple. And brown pigmentation in melasma and lentigo can be covered with a base foundation of using white. And depigmentation in vitiligo, depigmentation in post-inflammatory hyperpigmentation and vitiligo can be covered with brown base foundations. And contour defects too can be covered using the colored cosmetics. So, contour defects are defined as areas where the facial skin is hypertrophic or atrophic with textural changes due to the absence of appendageal structures, creating an uneven appearance surface on a surface. Now, these colored cosmetics can give rise to smoother appearance by way of using artistic shading, such as in this patient. Newer cosmeceuticals, bimatoprost, a drug initially used for glaucoma, has been found to have favorable effects for eyelash growth by its effect on eyelash hair cycle, melanogenesis, and effect on hair follicle. In addition, following this effect, eyebrow hypertrichosis, androgenetic alopecia, and alopecia areata has this bimatoprost has been used for these conditions too. And in addition, vitiligo, this has been tried in facial vitiligo too. So that's obvious side effects are the effects on intraocular pressure. In addition to the local side effects, it can cause periorbital darkening, which is reversible. However, it can cause irreversible brown pigmentation of the iris. And especially in condition and in vitiligo, they have noted unwanted hair growth over the treatment area. So, is there a beast in beauty? Yes, there are potential toxicity in cosmetics. A wide array of constituents in cosmetics have posed a serious threat to health and environment safety. I have only included a few of the ingredients that have potential for carcinogenicity, mutagenicity, effects on health, and environmental concerns. Parabens are a class of chemicals that have been extensively employed as preservatives in pharmaceuticals and cosmetic products due to their potential antimicrobial activity. And these are the side effects that have been documented with DNA damage, anti-androgenetic activity, estrogenicity, endocrine disruption, cytotoxic and genotoxic effects on human lymphocytes, and then there is a risk of carcinogenicity. And triclosan is also a lipid-soluble antimicrobial agent that is widely employed as a preservative in a variety of personal care products such as shampoos, toothpaste, and everywhere. And it has the potential to develop local side effects as well as systemic side effects such as endocrine system, nervous system, and also reproductive system. And there is also a potential carcinogenicity. And formaldehyde too is why I think Madam Indira will be discussing more on this. And there are a long list of chemicals that have potential implication for human health and environmental safety. So let us move on to something called permanent and semi-permanent makeup. They have become very popular as they give a fresh look just out of the bed. And in addition, for people with disability, poor vision can also enjoy the benefits of applying makeup because otherwise they would be hindered by their disability to apply regular makeup. Tattooing has been present for centuries and it has also been used to define eyebrows. However, the current trend is to move on to semi-permanent makeup than permanent makeup, as they can be changed according to the beauty trends or for other reasons such as patient's preference. In semi-permanent tattooing, pigment is deposited more superficially and it lasts about 1 to 2 years. And if to continue the trend, you may need to do touch-ups. So these are the eyebrows. Eyebrow techniques. There are few techniques available. So first one is called microblading, where the skin, the pigment is deposited on the superficial layers of the skin using a blade that is cutting into the skin in a stroke-like manner. And microshading refers to deposition of pigment using a device that tattoos the pigment in a dot-like fashion to give more soft powdered look. And combinations can also be used. So microblading uses a handheld device, and then this handheld and machine can be combined together to give a more natural looking eyebrow. So not only stopping there, eyeliners too are popular. So the lash enhancers are when the pigment is deposited in between the individual hairs in the eyelash, which in lower and upper eyelids, giving a more natural look. Whereas the eyeliner gives more dramatic look, and there are decorative eyeliners which gives more fashionable looks. So permanent and so semi-permanent lip makeups. The commonest are the lip liners and the procedure called lip blushing. So the lip liner will help to make symmetrical lip shape, that is according to patient's preference. And the lip blushing is meant to give a rosy appearance to their lips. And fashion trends are strongly influenced by celebrities, and freckle tattoos are a new addition. And we all know that who's responsible. Meghan Markle, if you don't know. So, briefly about side effects of permanent makeup. Obviously, the permanent makeup can give a permanent or semi-permanent makeup can give rise to granulomatous reactions. Commonly, this patient has had sarcoidal granuloma on your left. On the right, the patient has developed keloid scarring after complication from a microblading. In addition, infections are a common complication. So the side effects of other side effects could include the migration of pigment eyeliner, especially in the inner canthus, you may be able to see. And also, it all depends on the technical ability of the technician who performs it. So let's move on to the medical uses of permanent and semi-permanent cosmetics. So here it's a beautiful example where the lip symmetry has been obtained with nice contour for a patient who has undergone a cleft lip correction procedure. This patient with acrofacial vitiligo has got an excellent coverage following micropigmentation over face and lips. This male with androgenetic alopecia has shaved his head and used micropigmentation to simulate scalp hair. And micropigmentation is especially important in reconstructive surgery, where this patient has undergone nipple areola reconstruction following mastectomy. And some patients opt for more aesthetically pleasing tattoos to camouflage scars. And medical tattoos may be life-saving at times.
We have 2 minutes more.
Yes. So another new thing is extension. So semi-permanent fibers that are attached to natural eyelashes in order to give the eyelash fringe look of longer, fuller and darker look. And individual eyelash extensions are applied to individual natural eyelash using a semi-permanent glue. And in hair extensions, these could be made from human hairs or synthetic hairs, and they are usually clipped, glued and sewn onto natural hair by incorporating additional human or synthetic hair. So these two are associated with side effects. Commonly, the eyelashes extension, where there is blepharitis and keratitis and risk of blindness. And permanent eyelid tattooing, as I showed, there's a pigment migration, and there may have been inadvertent pigmentation of the conjunctiva and tear film instability. And some people do eyelash dyeing too, which can cause all the side effects associated with hair dyes. So I hope I was able to give you a brief overview about the commonly used cosmetic products and procedures. And thank you.
Thank you, Nisansala, for this useful and very timely lecture. I think we have time for a few questions. Can I ask one question? I think, as you said, a lot of people come to us like nearing their wedding and ask us whether to do facials and all. Now you said these USA recommend like occasional facials. So occasional means how often? I mean, before weddings they usually do like monthly facials and all. what they say. But like normal individuals, if they say we are going for facials, how often do they recommend? Like once in 3 months, or do you have?
They have not given a free as in a time limit, but what they have said is it is the effect of facials, and I mean apart from very high end ones like that, the facials that they do common in salons, they are the effects are usually one off, and it lasts only for few weeks, maybe a week or two even, and then the regular skin care is what is important to maintain the overall skin health. So the patient, I mean, if the patient is asking, what they have said is like for the patient satisfaction, you may say yes, but not really. You can give a recommendation.
So I think what you are telling is you can go for a facial maybe occasionally, but maintain your regular skin health
Exactly.
Daily on a
Yes.
routine basis.
Can I add? Sir, you mentioned about this drug Dermatologists.
Yes.
Have you used it on any patient?
No, madam, I have not used it, but Dermatologists is
Oh.
it is available.
Alopecia area, I think recently we asked one of our patients also to get it done about alopecia area patients. Expensive.
The ophthalmic solution has a bit of a higher concentration, madam. What we use for the eyelashes and the eyebrows is 0.03, and I think we have Sri Lanka has the ban, but not the lattice, which is the original FDA approved product. The
What's
original
the brand?
lattice,
Like this.
LITISE. Lattice. And I think, but I have seen patients with on Dermatologists who have come with periorbital pigmentation for glaucoma, not for the eyelash growth.
I would just like to add something regarding facials. So some of these brides, they start doing facials well before their gold facials, and the beauticians want them to do them regularly. I find that when they steam the face, that they end up with a crop of acne, and especially a lot of them are under treatment for acne, and then they come back with a bad episode. So actually, I tell them not to get the steaming part done anyway. Anyway, I tell them as a policy, I tell them don't do the facials now that you're on acne treatment. And just a couple of days before, I allow a facial so that everything glows on the day of the wedding. And then I say, okay, during the honeymoon we can't predict what will happen, but at least you'll look good on the day of your wedding. And also, I think a lot of other factors come into play, not like the West, because we are a tropical country, and with the sweaty environment, we have a lot of other issues. This is not regarding facials, but even with makeup. So you have to choose the correct kind of foundation for the correct type of skin, depending on whether you have a dry skin, an oily skin. So all that has to be considered, as well as the age of the patient, whether they are prone to acne, whether there is poor occlusion with foundation. All these have to be, so when they ask for advice, you need to take all that into consideration when you're advising them.